Good afternoon, everybody. I want to thank you for attending the webinar this afternoon. My name is Pam Beck, and I will be discussing the audit instructions for the STS database for adult cardiac. This webinar and the webinar we held on June 6th are identical, and you only need to attend one, which you know that already. But also the webinars will be recorded and put on the STS website. And just remember, keep your phones muted during the presentation. Thank you for your participation in the Society of Thoracic Surgeons Adult Cardiac Surgery Database. The purpose of the audit is to evaluate the accuracy, consistency, and comprehensiveness of data contained in the database. STS has selected Telligent to perform an independent external audit of the STS Adult Cardiac Surgery Database. Telligent has conducted audits on behalf of STS since 2006. As a quality innovation network and quality improvement organization, Telligent is HIPAA compliant and performs audits adhering to strict security policies. The audit process includes data abstraction performed by Telligent on 12 randomly sampled CABG only and 8 isolated valve cases that were performed between January 1st, 2016 and December 31st, 2016 and submitted to Duke Clinical Research Institute, which I'll be referring to as DCRI. The second part of the audit is reviewing the process to determine case eligibility for submission to the STS database and comparison of operating room logs with cases submitted. In addition, sites will be asked to complete a data collection questionnaire. A summer conference with Telligent and each site will take place following completion of the audit. Telligent will need to receive the medical record for the 20 cases via secure file transfer web portal 4 weeks after this webinar today, which is July 12, 2017. And we are allowing a couple of days due to the holiday weekend. Next, I will be talking about the attachments that you received via email on May 17, 2017. Please refer to the attachments during this webinar. Basically, attachment 1 that I sent to you includes the overall instructions of the audit. But first, let's go to attachment 2. If you'll bring that in front of you. And it's also on the screen. This attachment refers to the Telligent Secure File Transfer Instructions. I am not going to read this document word for word. However, I'm going to mention that medical records must be uploaded in PDF format and uploaded via secure web portal to Telligent. There are many ways to handle the merge of PDF files or other files. And I'm going to give you a couple of suggestions. Not everybody can do these, but I do want to bring this to your attention. If you have someone on your team with Acrobat Pro, other than the basic reader function, there is an option to merge files. It is very quick and easy. You just pick the files to merge, such as Word documents or PDF files, and click the button. This is better than using a zip file because a zip file unzips to multiple files. Using the merge method allows you to upload 1 to 2 files, which is the easiest and quickest way to upload the information. Another suggestion, if your site has the capability to use Acrobat Writer or possibly the export function of the electronic health record, you may have the ability to create bookmarks when producing PDF files. We think of bookmarks as section headers. For example, one bookmark could contain H&Ps, consultations, and a discharge summary. A second bookmark could contain all the lab results. And maybe a third bookmark could obtain all the operative information and so forth, and maybe one for progress notes. Regarding data files, we are asking that unique files be provided for each patient. In other words, we do not want one large PDF file containing data for all 20 patients. When uploading, please identify each medical records file that you upload with your participant ID and the patient ID or medical record number so that we can cross-reference them to our list of cases. You will need to work very closely with your own internal IT or medical records personnel during this process. As you are preparing your files or uploading them, Telegen will be here and will support and assist you in any way we can. Also, it's helpful if you would let us know when the files have been uploaded so that we may provide you with that verification. Just going to go over a few reminders on what I have discussed so far. The email that you'll use always is stscardiac@telegen.com. 1 week after this webinar, around June 15th, we would like you to email us with your contact information of the person that will be transmitting the medical records. We need their name, title, email, telephone number, your hospital name, and participant ID number. An account will be created for the person that's going to transmit the records. Telegen will provide the necessary secure login information and instructions. But again, refer to attachment 2 for the secure file transfer instructions. And after reading attachment 2, this would be a very good time to contact your IT or your your medical records department to discuss the process of transferring or uploading medical records to the secure file transfer web portal at Telegen. When uploading to the secure web portal, please limit the files uploaded to 1 to 2 PDF files per patient. Let's now go to attachment 3. Attachment 3 includes the list of 20 random cases selected for audit. There will be a column for you to document the medical record number or a patient identifier. And then the last column is a place for you to document what the 30-day mortality was for each case. Telegen only receives the record ID number for each case. The auditors will need to match the record ID to your medical record number to identify the correct case. Let's look at attachment 4 now. This pertains to your data abstraction and submission processes. Complete the questionnaire in detail and do not leave any blanks. The questionnaire is sent directly to STS for review after the audit is completed. It is a Word document, so you can click on each box, put your responses in, and they will wrap around for extra spaces for your comments. Try to be, very thorough with your answers if you can. Okay, let's return back to attachment 1. Like I said earlier, it's the overall instructions of the audit. And please turn to page 3. Telegen will re-abstract 86 data elements for each of the 20 cases. The data element list on pages 3 through 6 includes all the data elements that will be audited. For example, we will need all the lab reports, whether they be outpatient, pre-op, and post-op, to identify the correct creatinine level. We'll also need all the echocardiograms that were completed, outpatient, pre-op, and all the physician progress notes to identify complications, and etc. And below the data element list, directly below it is a checklist of documents that should be uploaded for the audit. This contains all of the 86, this information should contain all of the 86 data elements that we're looking at. And there's a checklist to assist you with that. The data manager is responsible for information that is provided for the audit. It is recommended the data manager review the information prior to uploading to Telligent's secure web portal. And again, I need to stress that it is very important to include outpatient or preoperative testing information, such as lab reports, echoes, cardiac cath reports, pulmonary function test results, and 5-meter walk tests for audit, especially for the same-day surgery patients that had all testing completed outpatient or pre-op. You know, we will look at the same information that you use to abstract your information. So, you know, you need to send all the data sources that you use to abstract your information. Outpatient and pre-op information such as lab results and echo reports and cardiac cath reports are the reports that are missed the most. If additional information is requested to complete the audit, you will be given 5 business days to submit the information. If not received in 5 business days, it will be counted as a mismatch for auditing purposes. Additional information must be sent to Telligent's secure file transfer web portal, the same method as the initial upload. Again, please send an email to the person that requested the additional information when it is transferred or uploaded to the web portal. Be sure to add the STS participant ID number in the subject line of the email. Any emails that come to stscardiac@telligent.com need to have your participant ID number. Also, you will need to include documentation when uploading pertinent to any post-op events, because we look at surgical site infection, deep sternal infections, and other complications. Therefore, the auditors would need to review all the physician progress notes. If the patient was readmitted within 30 days after surgery, the auditors will need the discharge summary and the H&P from that admission to verify if they were readmitted. You must also submit documentation to support alive or dead for 30-day mortality status. You can submit documentation such as an office visit note or a lab report. If, for some reason, you're unable to obtain this information to verify 30-day mortality status and you utilize a spreadsheet to keep track of your 30-day mortality status, the results of the 30-day from the spreadsheet may be submitted for audit. Again, the data manager is responsible for information that is provided for the audit and needs to review prior to uploading. It is recommended the data manager also save the files of the documentation that's uploaded for audit. The audits will be completed on a first-come, first-served basis. All sites are given the same amount of time to submit their records. This ensures we receive all the information in a timely manner so the auditors can focus on completing the audit. Next, we're going to discuss the second part of the audit, and that is the OR log comparison review. If you turn to page 7, there's a paragraph in there that discusses that. The auditors perform a comparison of surgical cases that were performed during the audit timeframe of 2016 to cases that were submitted to DCRI. We will ask you to provide a copy of the OR log or a spreadsheet that contains a list of CABG and valve cases only. This list must include the surgery date of those cases performed during the 3 months that we have identified, which is April, May, and June 2016. And include the procedure description for each case also. Do not include procedures other than CABG and valve cases. You are to return this file via secure file transfer web portal. Once you've done that, please send an email to stscardiac@telegen.com when files are uploaded so that we may provide you with that verification. And again, I want to remind you to please add the STS participant ID number to the subject line in the email. For the audit time frame of the OR log comparison review, the auditors will only look at a 3-month time frame, which is April, May, and June, for cases that were completed in 2016 rather than a full year. Now you can turn to page 8 of attachment 1 for the audit preparation checklist. Please use this checklist to help you with the requirements of the audit. I'm going to go through each one of them, and it'll be a good review of what has been discussed so far. Contact your IT and or medical records department immediately and discuss the secure file transfer protocol. Refer to attachment 2 for instructions. Audit-related questions should be emailed to stscardiac@telegen.com. Please include your participant ID number in the subject line of your email so that Telegen can better attend to your questions. Contact Telegen at stscardiac@telegen.com 1 week after this webinar today by June 15th with contact information for the person that will be transmitting the medical records. We will need the name, title, email, telephone number, site name, and your participant ID number. An account will be created for this person. Telegen will provide the necessary secure log information and instructions. Complete and return attachment 3, which is the list of 20 cases that includes your medical record number and your 30-day mortality list, or mortality questions. And upload that one via Secure File Transfer Web Portal. Complete and return attachment 4, the data collection questionnaire. You can send that via the Secure File Web Portal, or you may email that one at stscardiac@telegen.com. Obtain and send the OR log or spreadsheet of cabbage and valve cases only for the selected 3-month time frame of April, May, and June 2016 and upload them to the Secure File Transfer Web Portal at Telegen. It's encouraged that the data manager has reviewed the documentation to be uploaded to the Secure Web Portal at Telegen. And we also recommend that data managers save a copy of the documentation uploaded for the audit. Limit files that are uploaded to the Secure Web Portal to 1 to 2 PDF files per patient, please. Recommend to bookmark specific sections of the medical record, for example, 1 bookmark for H&Ps, consult and discharge summary, maybe a 2nd bookmark for lab results, or a 3rd bookmark for operative information, and etc. Ensure the medical records are uploaded to the Secure File Transfer Web Portal 4 weeks after this call today, which will be July 12th, 2017. So all the documentation, the medical records, the attachments are due by July 12th, 2017. Of course, you can submit earlier if you're ready to go. We don't mind that at all. The audits are initiated based on the timing of the receipt of all completed information. Upon audit completion, the auditor will schedule a summary conference by telephone to discuss the audit findings. Anyone can be on the call. If the surgeon representative wants to be on the call, that's fine, but it is not required. A data review summary report, which includes agreement rate percentages, mismatch details report, and OR log comparison report will be completed and sent to the STS. STS will review the reports and email them to the primary data contact and the surgeon representative. Thank you. That's all I have today, and we'll open the line for questions. Anybody have
The leader has unmuted your line.
Oh, hello. Hi. I have a question. Hello.
Okay.
My first question is, so when you send your primary contact information, how long after that does it take to get your access to start sending items? Hello?
Yes. How long does it take to what? I didn't hear what you
I'm
said.
sorry, I couldn't tell if I was muted. I thought I'm looking down at my phone like, am I muted?
No, fine.
So how long after you send your primary contact information does it take to get access to the portal to start sending things?
You will be right away. As soon as I sign you up, get an account set up for you, you'll get an email and you can start anytime. And we do that as soon as we get the information from you.
Okay, great. And then my second question, in reference to surgical site infections within 30 days, what kind of documentation are you looking for? Are you looking for like a physician progress note, or is that something?
Yeah, anything that would be helpful to verify that, whether it be an office note, or if they happen to be readmitted within that 30 days, or
Does there have to be something there on every patient that speaks to that they don't have a surgical site infection within 30 days?
Well, if we don't see the information, all we can do is assume they didn't have an infection.
Okay.
So if they do have an infection, then we just rely on you to submit that information. Because we know what your answer is, and we have to verify that. So if you answered yes to surgical site infection, then we'd have to have that information to verify your answer.
Okay. But if you answered no, you wouldn't necessarily have to have... Okay. All right. That makes sense. Thank you.
Okay. You're welcome.
I have a question about the 20 case list and the OR log. Do we send that prior to the rest of the data sent in?
Yes, you can if you're ready for that.
Okay. Well, as soon as we get our access, we can send that in anytime.
Yes.
Okay.
And that's also a good practice, to upload, too.
Okay. Thank you.
Hello.
Hi.
I do have a question about the OR log. You said cabbages and valves only. Are you talking about just isolated AVRs only?
And mitral valve. We also we review isolated mitral valve and isolated AVRs, and then cabbage only. So
none of the cabbage plus valve. So you're basically straightforward looking for cabbage, AVRs, and mitrals.
Yes.
Okay, thank you.
Hello.
Hi.
I have a question. Based on the list that we received of 20 patients, we have a patient that had their procedure done January 6th. Should we include that patient? It's outside of that second quarter window.
Hi, this is Leslie at Telegen also. So if you have a patient selected on the 20 case list that is not in the 3 months that Pam mentioned, the 3 months that she mentioned was only for the OR log comparison review. We just looked 3 months through information for the OR log comparison review for the 3 months she mentioned. For the list of 20 cases, we look at any procedure performed during the year 2016. So that's why you probably have one in January 2016.
Thank you.
Welcome.
I have a question. Hello?
Okay. Yep, I hear you.
Okay, if a patient is readmitted, you said that what kind of documents do you need to put in there to show that? You said a discharge summary from the readmission?
Yes, that or an H&P, something that we can look at.
Okay. I don't hear the
don't need the whole chart. We do not need the whole chart.
Okay. All righty.
Thank you.
Hello, this is Chris Syker from Winchester. Can you hear me?
Yes, I can, Chris.
Oh, great. All right, great. I have a question for the people that are getting the access. Because I want to be doing some of the work and then my medical records will be doing the other, can I get two accounts? Two different, two logons?
Yes.
Okay, great. Thanks.
I do have another question regarding what do you mean exactly when you said how is the mortality at 30 days after surgery determined?
Well, we need to answer that question, were they alive or dead at 30 days? So we just need to know how you came up with that answer. If you are able to get to a physician note or an EHR lab result for verification that they're alive at 30 days, that's fine. If you don't have that capability and keep a spreadsheet, and on your spreadsheet maybe you do a phone call, that's fine too.
Okay, or do the follow-up visit count?
Yes.
Okay, all right.
In follow-up to that question, do you have that spreadsheet with the list of 20 cases which asks the status? If we say a live office visit was greater than 30 days, do you need us to print out a copy of that office visit note and include that, or is that good enough on the spreadsheet?
If you have the capability to get that office note, that's what we really like. But some facilities or hospitals do not have that option, and so they keep their own spreadsheet of the mortality status. And that's how they keep track of it. But if you can get an office note or any kind of lab report for verification of 30 days, that would be great.
Yeah, I mean, we view it in Centricity, but we don't have the ability to print it and include it. So keeping it, as long as we're clear on the spreadsheet, that seems like that would be sufficient.
Yeah.
Okay.
Can you just do a screenshot if you don't have print capabilities?
Yes. A lot of people do screenshots. Hopefully we can read them.
Right. Thank you.
I have a question.
Sure.
Hello. My question is, if we don't have the capability for the merge and that type thing, is it all right for us to, for lack of a better term, create a paper chart and scan it in as a PDF and that be sufficient?
I mean, that would be fine, but that would take a lot of time for you guys.
I know, but I think that's about the only choice that I have at the moment. So.
Oh, really?
When I did this for STS in 2000, I guess it was before y'all started. That's what we did, and we actually mailed them at that time.
Yeah, now we don't allow paper anymore. Those days are gone.
Oh, absolutely.
Yeah.
Have like just a header page that says H&P and consults and have that section, but then just scan it all in as one page when I'm done.
Okay.
Is that acceptable?
Sure. We know that not, everybody has the same capabilities as others, so.
Okay. Thank you.
You're welcome.
I do have another question regarding your preoperative testing. We don't normally routinely do a pre-op PST and the 5-meter walk test. That test we only do for our TAVRs.
Okay. That's fine. If you don't do it and you answered no and we don't have the information, that would be our observation also.
Okay, and where do
and usually by the time we get to the 10th case and you've answered no on all of them, we know we have a pretty good idea you probably don't do them. The 5-meter walk test.
Are you talking about responding to no to that checklist? Is that where we answer no?
No, when you do your own abstraction and submit data, when you answer your questions.
Okay, all right. I'll just check. We use Apollo for our data entry.
Oh, that's what I meant. Yeah.
Oh, okay. That's what you meant. All righty.
Yeah.
Thank you.
Hi, Pam. Hi. So, with all the attachments that you've shown on the webinar, when were those sent out? Because I don't have those.
Oh no! How'd that happen? They were sent on May 17th.
I was let known about this webinar, but there's no attachments on my email.
Okay, we can resend those. What's your provider ID?
My participant ID is 14866.
14866?
Correct.
Okay. And are you the contact person?
I am.
Okay. What's your name, please?
It's Kathleen Hettinger.
Okay. I thought we talked about that. Not. I'll resend it today.
Thank you.
I have a question. Can you hear me?
Yes.
Yeah, it has to do with the surgical site infection again. So are you saying that if we provide a note from the doctor 30 days after surgery and there's no mention of an infection, you're going to assume there was no infection?
Correct. But you don't,
okay.
Yeah.
But you don't have, I'm sorry, this is Alicia Garber again. I'm the one that asked the question initially. So you don't have to send a note for 30 days that says no infection, or
no.
It doesn't.
If you answered no to that question, you would not have to send it in. We would assume they didn't have a 30-day infection.
If you answered yes.
We don't expect you to send all of your physician office notes. No.
Okay.
Hi, this is Chair.
Okay. You can send it.
Hi, this is Chair from Hawaii. Pam, can you hear me?
Yes.
Oh, okay. I have a couple of questions. First question is I needed just some clarification on the due date. There was 2 dates mentioned about the medical records, the 20 cases for the secure file transfer. I heard July 12th and July 17th. Due to the holidays, there was an extension?
No, it's July 12th.
July 12th, okay.
Yeah.
And second question, in regards to all labs, do we need to provide all labs, or is it just specific ones that are being audited at this point?
Yeah, on the data element list that you have, you'll notice that we audit INR, total bilirubin, and creatinine.
Okay, because I started this gathering the information already for the patients that were selected, and I already printed out all labs because I wasn't sure. Is that okay to submit, or do you want me to go back, go through those 20 patients and just print out those selected ones?
No, that's okay if you've already done it.
Okay.
Sometimes we also need to look at the hemoglobin A1C, for diabetes times and stuff.
Right.
Specific values. That's fine.
And I'm averaging about 200, 300 pages for each patient. Does that down where I'm at the right track here? I just want to make sure I'm doing this correctly.
Yes, that does sound about right.
Okay.
Yeah, if you look on that page for required information, it's quite a long list.
Right, it is.
That we do need, because we look at 86 data elements. So there's a lot that we are looking at. Mm-hmm.
Okay. Thank you. Hey, Tam, this is Faishan. I just want to know can we call you if we kind of remember some questions, if we have additional questions for you?
Yes.
Okay.
Or you can shoot an email too. Mm-hmm. I'm going to go back to I'm going to go back to the 2 dates that one person mentioned. The June 15th date is the date that I need the information on the person that will be transmitting the medical records. That's by June 15th. We need that information so we can get an account set up for you. And July 12th is the due date for everything, the medical records and the attachments and the OR log. And on the next to the last page, there's a real nice, there is a checklist, and just kind of go by that too, and you'll meet the requirements of the audit.
Is your email included in all this paperwork?
It's the STS cardiac at Telegen.com. Use that one and it'll get to me.
Oh, okay.
I'm sorry, would you repeat that?
It's STS cardiac.
Okay.
Yeah, it's the one that's in your attachment.
Got it, okay.
Yeah, we use that for everybody that it gets to the right person.
Okay.
I have a question.
Okay.
If a patient is not readmitted and we've answered no, do we have to show some proof that they have not been readmitted?
No, you do not.
And on the checklist for documents to be sent, you have perfusion record, and the information on our perfusion record doesn't have any of the audit elements on it, so do we still need to send that?
Well, it depends on where you get your height and weight from.
Okay.
If you get it, if it's on the anesthesia record, that's good, because that's where we like to take height and weight is from the anesthesia perfusion records, because hopefully they would have the correct weight for surgery.
Okay.
Also, sometimes the perfusionists, sometimes they put labs down when we don't get any other labs. But, if you just remember to send all your labs, then that'll cover that.
Okay. And I have another question. I had an echo that was done more than 6 months prior to admission or prior to the surgery, so I was not able to use that according to the STS guidelines. And I had answered no, for no ejection fraction or stenosis. Do you still want me to send that older echo to show that I didn't have one, so that we're not getting a request for, that we maybe forgot to send it to you?
That might help, yes, because that makes us look, at the dates like you do. So,
okay.
If you have that would be fine.
And if we have some strange circumstances with a record, is there somewhere where we can document our rationale?
You bet. Just, include it in the file with that record somewhere, on a Word document or something.
Oh, okay. Okay, Word document. All right, thank you very much.
Thank you.
Hi, this is Chia again from Hawaii. I had a quick question regarding the height and weight. Currently, what our process is that the height and weight is being imported from our electronic hospital records to our cardiac software, CDROD, and they were able to provide me a worksheet that lists the height and weight for all of the patients, the 20 patients. Is that sufficient to submit?
Is that the closest to surgery?
Yes.
And that's what you use?
Yes.
It is? Okay. Is it the same one on the anesthesia form? Is that where he gets his weight from, the anesthesia person?
No, I don't believe they're obtaining that from the perfusion form. But for demographics and height and weight, it's being abstracted automatically and imported into CDROD. And so those fields are already populated. So the best right now, what I can do is just provide you folks the worksheet that lists the height and weight, and I just want to make sure that's going to be sufficient.
Yes, that would be fine.
Okay, thank you.
Any other questions? Are we good? Okay. again, if you think of something, email that STS cardiac@telegen.com email, and somebody will help you out. Thank you, Oh, okay. Go ahead.
All right. If I want to send both, I would be the person submitting and the data manager in the same email. Is that okay as long as I have it labeled appropriately?
Yes.
Okay. Thank you.
Well, thank you, everybody.